Hello and welcome to our podcast Pager. I'm George Milner.
And I'm Stan Dale.
Tune in to hear us talk with some amazing people about the subjects changing medicine today. In this short series, we speak to the editors-in-chief of three of the world's top scientific journals: the Lancet, the New England Journal of Medicine, and Nature. A broad theme running throughout is what are the roles and responsibilities of journals in the 21st century. In this episode, Dr. Eric Rubin, editor-in-chief of the New England Journal of Medicine, joins us from Boston. Dr. Rubin took up the role in 2019, having previously worked as an associate editor and professor of immunology and infectious diseases at Harvard. We talk about everything from how the journal decides what should be published, the role of journals in shaping good scientific practice around the world, and the approach taken by the New England Journal in communicating science to a wider audience. Enjoy the episode, and don't forget to subscribe wherever you get your podcasts. So, okay. Eric, thanks so much for joining me. So from a sunny southwest of England, welcome on the podcast.
Thank you. Thank you for having me.
I'd like to start off just by asking, what do you think makes a good editor?
Well, I'm not sure I'm the one to ask. I've been at it for not that long. I think different people bring different things to the job. I think that there are people who are great editors. They're great at writing and wording and wordsmithing, and that is an incredibly valuable skill, which probably isn't mine. There are people who bring a vision for how they're going to change what people do. There are people who are good managers and good people who have to run these large organizations that publish these journals. I think there are lots of ways to accomplish it, and I'm not sure there's one right way.
Moving towards the work that you do at the New England Journal, I'm just curious, what sorts of criteria currently does a paper have to meet in order to get into what is one of the most prestigious journals in the world? And how have these criteria changed, if at all, during the pandemic?
That's a really good question. I think that in general, we are different from many scientific journals. In the past, I'm a basic researcher I still have a lab and publish a lot in basic science journals and have been an editor at many basic science journals. Basic science journals are looking for what's interesting out there. And they're looking for a certain kind of scientific rigor. For us, at least at the New England Journal, it's different though. We're looking for things that are going to have an impact on patient care and are likely to be true. Not just done correctly, but also likely to hold up. We're very concerned that whatever we publish will be followed by physicians, and therefore we feel a responsibility to be sure that we've done the best job we can of figuring out if it's true. Now, that means a couple of things. That means that we do look for rigor, and we primarily publish randomized controlled trials because they are the current gold standard in medical research for proving something. However, we publish other things as well, including very early phase data where we think there's a new agent, a new therapy that could have an impact, but is not available yet. For those, our standards aren't exactly the same because since a physician can't prescribe them the next day if they're unavailable, we're not so concerned that we're publishing something that could turn out to be incorrect if it looks exciting. But frankly, we publish some really boring things that are really important. And hopefully we publish a lot of exciting things as well, but important and having an impact on patients is really what drives us. So how has that changed during the current outbreak? It hasn't for the most part. We still look for rigor. We still don't want to publish things that are going to injure patients. We want to publish things, or to put that more positively, we want to publish things that are going to help patients. But I'm a physician now, and when I have been in the hospital a week ago, I was on the COVID-19 service. I'm struck by the fact that it's very difficult to make decisions for patients, given that there's hardly anything out there. So we have published some things which are not the usual New England Journal of Medicine study. I know we've been criticized for that, but with the idea that some carefully considered quality information is better than nothing. And so we still want to publish the RCTs, the randomized controlled trials, but there have been very few, and therefore we have published things that are not our usual fare.
I guess what you're alluding to here is perhaps the remdesivir trial that you published for compassionate use. So where does this balance do you think lie? Because even if you are clear within a paper exactly what it should be used for, what it shouldn't be used for, people can see around the world the New England Journal paper, and that has certain associations with it that can be carried through, perhaps regardless of its content. Are you concerned about that?
I think we are. And I think, again, another difference between us and the journals that I've worked at before is we heavily engage with the authors to rewrite manuscripts and change their messages. Sorry, little Japanese in the background, but hope you're not picking that up too much. So we help the author shape a message that we can live with. And so the published manuscript is really very different from the submitted manuscript almost always. And certainly when it comes to the broad conclusions that can be drawn. So we're very into shaping the message. We tell authors from the beginning that we are willing to proceed with their manuscript as long as we can help with a message that we can live with. I think that gives us a chance to have a positive effect on how things are presented. Surprisingly, we occasionally, maybe a little more than occasionally, will accept manuscripts that we think are not quite our usual because we can shape the message, for fear that if they go somewhere else, they will be published pretty much without changes and have a negative impact.
And moving on from this, do you feel that perhaps the most prestigious journals in the world have a role for shaping how research is done, not necessarily just how it's presented? Do you ever turn around and kind of imply, actually, these are the sorts of things we will be looking for in a trial, particularly now, given there have been very prominent people standing up and saying that actually with all these small trials done for, say, hydroxychloroquine, they could have all been done together in a larger thing that would have been much more useful to stop kind of wasted scientific effort in a pandemic?
So unquestionably, and I think let me deal with that in two ways. First, I think that the major medical journals have an important impact on how research is done. We have over many years changed the standards of what we will accept and changed the standards of statistical analysis. And I think that has had a broad effect on medical research in general. When journals say this is what's acceptable, then researchers eventually come to the conclusion that they want to publish in those journals, and therefore they should be following those standards. And some of those are very explicit, such as those that the International Committee of Medical Journal Editors have established that, for example, around trial registration and such, which only really works because journals enforce it, to the details of how a statistical analysis can be done, how trial design it can be done. So I think we have an important role there. As for the specifics of the COVID-19 outbreak, I think that we do have a role in what we're willing to publish. And we're very conscious of the fact that when we publish uncontrolled case series, that we could be encouraging what we don't want. So we're trying to thread a needle here and deliver information that people can use. At the same time, we discourage people from doing research that is lower quality and less helpful. You're absolutely right. It's stunning that hydroxychloroquine hasn't been studied in a good placebo-controlled RCT yet, at least that I'm aware of, while people have been doing lots and lots of large case series. So I think I certainly don't want to give the message that that's a good idea.
And do you feel that as a journal, you have a duty to correct misinterpretations where they arise, for example, in the mainstream press relating to research in the New England Journal?
That's a really good question. We generally don't feel like we have that role. We feel like that is the responsibility of the authors. The authors have done all the work. I don't want to enlarge our role more than it is. We're publishing other people's work, and we're helping them communicate those ideas. But it is their work, and they should be standing behind their own work and be both defending it and helping to interpret it. So generally, we don't want to take their place. We don't want to usurp the place of authors in helping to interpret the work. Occasionally, we do that, but we try not to. And as far as correcting the record, we try to be accurate the first time around, and when we make mistakes, we try to own up to those. I will say, though, that we're not the research police. We have a limited ability to investigate. And for the most part, when there are questions of, for example, misconduct in research, we pass that on to the institutions that sponsored the research rather than doing that ourselves. We just don't have the capacity to do it.
But at the same time, a journal might be in the best position actually to correct the record. You have an enormous platform to do that from. And if an author wanted to work with you in order to do that, would that be a good compromise in that situation? Because their voice might be drowned out amongst an enormous cacophony of reporting around the world.
Again, I don't want to be in the position of deciding what the truth is. I don't want to be the adjudicator of that. We are asked all the time about studies that we published and what they mean. And I have very strong opinions that I hold personally, but they're my opinions. And I don't want to detract from what the authors had to say. In many cases, for most important research, well, that's not true, but for many things we publish, we commission editorials to help explain what happened. We have perspectives that oftentimes amplify on research areas or sometimes on specific publications. And I think that is the role for both the authors and for other experts in the field to help interpret the data. I'm not an expert on everything. We publish in every field possible. And I appreciate the fact that there should be diversity of viewpoints.
So certainly leading journals are champions for evidence, but do you think they should be champions for how evidence is used, for example, to inform policy?
I think that different journals have taken different paths with how research should lead to implementation. I think that there are many ways that a journal can do that. Some of them are very explicit by publishing guidelines and such, that professional guidelines for how to interpret the body of research. We haven't done that in the past, and I'm not sure what we'll do in the future. But I think that is important. It may not be the role for the New England Journal of Medicine, but there are certainly many journals that are publishing clinical guidelines that are, I think, extremely important. There are just a lot of them, and we have a limited number of pages. But I think that when it comes to setting policy within medicine, that is certainly the role of journals. Setting policy outside of medicine, public policy, I think there are opportunities to do that. And I think that we have, for example, the perspectives section in our journal is very heavily oriented toward public policy. We publish quite a bit in that area, but it doesn't represent the journal's viewpoint. It represents the viewpoint of the individual authors. We certainly commission some of those, but even when they're commissioned, they're not our editorial perspective. Very occasionally, for us, we will publish editorials by the editors representing our viewpoint as a journal, but we use that very seldom. We do that very, very seldomly. Other journals do that much more commonly, and I think it's a stylistic question.
How political, therefore, do you think a journal should be? Say you use these very rarely, but should it have political stances?
Good question. Let me just talk about our journal. We have taken political stances before, and for example, the most recent editorial that we published that was signed by the editors as a group was on access to abortion in the U.S. That was last summer, and we haven't done anything similar since that point. I think that we do have strong opinions about how research should be done, for example, and I think it's likely that during the course of this outbreak that you will see more pieces from editors, perhaps not all of them, but editors about what kinds of research should be done and perhaps how the findings of that research should be implemented as policy in our pages. So there'll be some of that. I think that there are other journals that are very political, as you know, and I applaud them for that. I don't think that's us.
Why in particular do you think it isn't you? Is that just a stylistic point? Is it perhaps even a convenience being in America? Are you in any way, actually, I don't know how this will come across, but afraid of playing with fire in who you criticize somewhat in the States?
So I don't think it has anything to do with the states. It happens that some of the major medical journals that do take strong political stances are in the UK, as you know. But I don't think it's that. It's that stylistic for the authors. For me personally, I have strong political beliefs that I'd rather not articulate in relation to the journal. What characterizes us? What characterizes the New England Journal of Medicine? It's our reputation to produce really thoughtful, well-researched pieces in a way that can be trusted. When we go into politics of our own, as opposed to editorial comments, but if we go into politics of our own, I think that we can undercut that to some extent. We want people to read our research articles and say, this is true, or this was very carefully done. And we know that because the journal, we know we can rely on this journal. Now, there's plenty of politics in our pages. It comes from outside commentators. So it's not that we are avoiding politics, but institutionally, I think that the political causes that we should be behind should be extremely important and extremely related to the work that we do. For example, when it comes to women's choice in pregnancy, we frame that as a medical issue, not as a political issue. And I think that can be equally true of other important causes, other important political considerations, such as climate change, which has strong impacts on medicine, and the public policy of reopening in the middle of an epidemic. I don't know what will happen in the future, but my sense is that we should be confining ourselves to where our expertise counts.
So you took up the role of editor-in-chief back in September 2019, and not that long ago. And what do you see lying in the future for the journal? What do you think is going to change, perhaps?
Well, I think that like other major journals, we're a print journal, and print is very important to us, and it has always been. But print is not the way of the future. Our job is to communicate. And I have to say, we're not just a print journal. When I say that, some of the people at the journal get very angry because most people read us online now, and we have a lot of multimedia. That's going to have to continue to enlarge. How do young physicians get their information? They don't sit down and read through page after page. Many people never read any of the original articles we publish, which we pour our heart and soul into and argue over word for word. Yet, not that many people read them. They may read the abstract. And so we have to be really careful with the abstracts, but we also have to be communicating the information in a rigorous way that we can live with to people who are going to read it on Twitter or or at least on Facebook or something. So we have to be really thinking about the future and how we can continue to be the major communicators of medical information.
What do you think of this move towards open access? I know that New England Journal papers are available 6 months after publication to the wider public.
I think it's interesting, and I've been an editor at open access journals in the past. What we do at the journal is different from what many of those other journals did and continue to do. We produce a heavily edited product. So when you read a manuscript in the journal, you can pretty much count on there being changes in almost every single sentence. And not just stylistic changes, but the conclusions could be entirely changed from positive to negative during the course of, during the editorial process. We have a full-time team of manuscript editors. We have a full-time graphics department that redraws everything and reformats everything in a way to maximize our ability to communicate. It's a really expensive process. And the way that's paid for right now is through traditional means, advertising and such. And we could never pay for that using open access authors fees. So for right now, we kind of like our model. It's free for authors to submit. Anyone anywhere in the world can submit for free. The whole process is free. It's free to publish. And our subscribers are paying for that. And our advertisers are paying for that. If I could do it without subscribers and advertisers, I'd love to do it. But I would rather not compromise on the quality of what we make, what we produce.
I'm conscious of time right now. So I had one final question just to touch upon, which is, how do you approach the issues surrounding conflict of interest that are prevalent all around the world in publishing? Because after all, on one hand, some of the best experts are the ones that have the most significant conflicts of interest, but also they can get journals and authors into a bit of trouble.
I think this is a a constant process of reflection. When it comes to research articles, it's relatively simple. We require authors to disclose using the same standards that almost all international journals do. And we publish things from drug companies all the time. We work hard to try to make sure they're presented neutrally, but we also disclose the fact that they came from a drug company, and a reader can take that into consideration. We really restrict the conflicts that editorialists are allowed to have. But I think, as you say, many potential editorialists who are most expert are going to have conflicts. And I think we play that balancing act all the time. We have a set of rules. I would say that almost every editorial meeting, we discuss potential conflict issues with a specific editorial that we're publishing, or review article, or something like that. It's hard to make bright lines, but we do have the flexibility to think about each individual piece and what works.
And is there any scope for perhaps reflecting on what effect a conflict of interest has on the work that's been produced? Because it's one thing recognizing that it's there, and it's another thing actually thinking of the effects of maybe pharmaceutical sponsorship or whatever it may be.
Again, I think disclosure helps, but it doesn't cure all ills. And that is why we do have restrictions around editorialists. Not only do we have the restrictions, but they still have to disclose. I don't think there's a single answer. I think it very much depends on the topic and the individual. And I'm sorry, I'm in the kitchen because there's lots of background noise.
Oh, that's okay.
And I think that we're comfortable with setting guidelines and then handling everything on a case-by-case basis. That is not true at every journal. I know other journals have very hard and fast policies, but we feel like at a journal where all of our editors meet 3 times a week, 4 times a week right now, we can discuss issues thoughtfully and in the context of what other choices we've made in the past. So we have some continuity.
And I think that's probably a good note to end on for today. So Eric, it's been an absolute pleasure. Thanks so much for chatting with me. I really appreciate your time.
Thanks, George. Thanks, George. Good luck with it. Bye-bye.